Hello there, my name is Kaylee. I'm a soon-to-be physician, and this is Dr. Watson Talks, where I talk all things medicine. I will be posting the audios on Wednesdays, and I will be posting that video to YouTube on Thursdays, and also all the content that you see me talking about will be on my blog, like the transcription, the documents, and the downloadable documents. Today I will be talking about my personal statement. Sorry, my dog's on here. My personal statement application, showing you guys the process that I went through to get the final product. As you can see by the title, I actually paid a professional $700 to do this. I may tweak it a bit more afterwards. Since applications aren't due for another month, but I really wanted to get this out there for anyone that's struggling with their personal statement or just needs a little bit of inspiration, like, what's she doing? And from my writing advisors, it seemed like I could basically turn it in if I want to, but if you have it's kind of like I don't know if anybody else watches Jenna Marbles, but it's like the 2 months gene where you kind of have to like turn yourself off. So that's kind of where I am right now, where I'm like, ooh, but what if I make it just a little bit more perfect? Because I have, not a lot of time. It's like 3 weeks, but yeah. So as you know, personal statements are very personal. So you'll be hearing a lot about me and my personal journey to medicine. And I do have a trigger warning for domestic and drug abuse. So if you do not wish to hear about that, I hope to have you another time. And without further ado, let's get into it. So I don't really want to read my own, so I got the voice to do it for me. I'm sorry guys, I know it's not nice to hear a robot all the time, but I promise I spent like an hour or more trying to find the best one. So Laura is our gal today. There's another one that was Gwyneth Stefan, but I'm too cheap to pay $140 a year for her, so we're going with Laura. She's our girl today. So I'm gonna go ahead and show you my first draft. This is the first one I ever came up with, and if you can see me right now, then you're able to see the screen, but you're not missing much if you are an audio listener right now. So yeah, let's get onto it.
While my journey to medicine is not the most pleasant story to share, it is important to illustrate my capabilities and perseverance. My mother was an alcoholic and drug addict. My father was a 5'11", 200-plus pound man who would also abuse drugs and physically assault my 5'2", 103-pound mother in front of me. Even though I never met my mother when she was sober, I had a soft spot in my heart for her and would visit her even after my 2 little sisters and I were removed from her custody. On my 13th birthday, she overdosed in my lap. As I shook her limp body to try to elicit a response, I felt utterly helpless. I knew at that moment that I had to choose a life that was different from my family members. That was the day that I knew I was going to be a physician. Rather than allow my past to decide my future, I am empowered by it. Growing up in a chaotic environment, surgery naturally called to me. In almost no other setting would it be possible to witness a 300-pound, sleep-deprived man perform a bedside ECMO during a code with the grace of a ballerina and overwhelming calm. The way that the cardiothoracic surgeon controlled a room of 20 people, did not blink an eye as the chest compressions I was performing caused an arterial spray on his face shield, and ultimately saved a middle-aged man's life was simply awe-inspiring. I will make a great surgeon because I am adaptable, determined, and compassionate. A well-seasoned pilot that managed to do more push-ups a day than I could in a year presented to the emergency room with typical signs of a stroke. After the initial evaluation, he was admitted to the hospital for observation and blood pressure control. When I was completing my morning rounds, I noticed that he had an acute change overnight and I immediately consulted the residents managing him. They told me that because it was documented that he had slurring of speech and unilateral weakness upon initial presentation, there was no need for escalation of care. This placed me in an uncomfortable position. I was a third-year medical student disagreeing with my immediate superiors. I respectfully insisted that he be seen by neurosurgery, as I had been on the admitting team the night prior and knew that his condition had worsened, even if on paper he may appear to be the same. I am grateful to this day that I had the confidence to do so. Neurosurgery ordered a stat CT scan that revealed a hemorrhagic subdural hematoma that would require an immediate burr or craniotomy. The patient was able to get back to his impressive workout routine within a few weeks due to the urgent intervention that I was a part of. A man recovering from his first seizure secondary to glioblastoma multiforme was recovering in his ICU bed. When I asked if he knew why he was in the hospital, I realized that no one had informed him of the circumstances that led to him being in the intensive care unit. After the seizure, he had right-sided weakness, and as I calmly explained to him what had occurred and that his seizures were now controlled on the proper medications, he began to slowly lift his right arm. I could tell that he was using all of his concentration and strength to do so, and I realized that he was using such great effort just so that he could pat my hand in appreciation for the news that I provided him. The patient had been treated by multiple healthcare workers that day, but none of them had communicated with him. After completing morning rounds with the attending, the patient's wife pulled me aside to thank me for taking the time for proper patient care. Her husband had worked hard to retire in his 50s, only to be diagnosed with terminal brain cancer a month later. She broke down in tears as she stated that the majority of the people that provided care for her husband had not treated them with respect, and that she was happy that someone like me would become a physician. I intend to always treat patients and their loved ones with the respect and care that they deserve. There are many qualities that contribute to being a great surgeon. Prior to my clinical training in surgery, I thought that having a steady hand and the ability to command a room were the main qualities that a surgeon needed. Surgery is so much more than that. To be a good surgeon, one must have the communication skills, up-to-date knowledge, and empathy for the patient to truly grasp why a procedure may or may not be essential. A surgeon must be incredibly adaptable, prepared, and calculated, as nothing is guaranteed when they step in the operating room. Throughout my medical training in everyday life, I have observed and incorporated these qualities so that I may one day be the surgeon patients and peers desire.
Alrighty, so she wasn't so bad, right? So now I'm just going to show you the first initial contact that I had with the writer. I was basically just kind of saying that my main concern was how dark it came across. Like, I was worried about especially the beginning part, but I knew that I had to include it because it's such a big part of what brought me to medicine and what has shaped me as a person. So I was like, I'm just a very descriptive person. Like, whenever I describe anything, I'm just a visual person in general too. So that's why my descriptions tend to be very visual, but that's not really what you want in a personal statement. So I'm happy, I paid the $700. It was 400 for one, and then something. I think you can even see it in the first contact. You can't see it too well on the screen, but everything is on the blog, and I'm gonna just talk about it right now. I was concerned about the flow too, like basically in the same paragraph, but that's what they tell you to do. In the same paragraph, you're supposed to talk about yourself, but also by the last sentence of the first paragraph, you're supposed to say why you want to do surgery or have the intent of doing surgery, apply for the residency. So I had a really hard time with that. Let's see. And yeah, I was just having a hard time with including all my hardships, I guess, but it was hard because they all impacted me, like I lost my mom when I was studying for STEP. Like, it was literally like a month and a half before, so my STEP score dropped like 16 points, like pre-test versus what I actually got. So I feel like it's something that should be included, but that's why I'm including on my supplemental. So I feel like it was worth it to know what to leave out, what to leave in. His main thing was that he basically confirmed my doubts. He said, I'm just going to read you exactly what he said because it was very helpful. Well, first of all, I'm so sorry. Your story is so heartbreaking. It It also was well told, you're a very good writer, thank you. Shorten, he listed it in numbers, so the first one was shorten and thus lighten your story into medicine. We should tell it more generally because the details almost make it too vivid and memorable. It's because it becomes a focal point. Your personal statement needs to sell your abilities, not your background to prospective programs, which that's very true. You're not selling what you've gone through, you're selling what you can accomplish. I love the image of the sleep-deprived cardiothoracic surgeon performing with the grace of a ballerina. Mention him for sure. Don't dwell on him though. Again, your personal statement needs to focus on you as much as possible, on what you offer as a residency candidate. Yeah. Consider either shortening both patient stories or eliminating one another. So after that, I went ahead and told them yes. So he just did that for free, just gave me an initial, like, this is what I would do. And then I was like, okay, I want to move forward. So then he sent me a survey. And this is just for if you're curious about like the process of if you're going to have someone help you edit it. It was, what specialty is this for? What made you want to become a doctor? Why did you choose this specialty? The like talking more about some roles that you've had, all that good stuff. And they said, can I embellish your story a little bit? And I said you could try, because I feel like I was the one that embellished it, or I didn't embellish it, but I was, like you said, really descriptive. And then, what do you want to do after residency? What are you looking for in a residency? Is there anything else that you wanted to mention? And that's where I mentioned like losing my mom, but he was like, yeah, I don't think I'd do that. Oh, and I also mentioned like, I have Amazon books published, and I have YouTube content that's monetized, and I'm really proud of that stuff, and I did it during medical school, so I feel like I should include it because it's another part of me. It would make me stand out. And he was like, that's an idea, but at the same time it's not the best idea, because he has heard in the past of students like kind of talking about like, oh, I have this business, I do this, and residency programs didn't seem to like it too much. And then this was his initial. I'm not gonna read this one or have the lady read it, just because I had 3 edits, so this is the first one, like right off the bat. And then, hi Kaylee, I attached a few notes, and yeah, he was just kind of explaining everything. And then I'm actually very lucky in that I also have a really wonderful school writing advisor. She's awesome. She was so nice to me the whole time, and she gives awesome feedback. So I had the professional writer, and then she's also a professional writer who is free. So I loved having 2 different feedbacks, because each time it was like they always added something really good that I really felt like made it so much stronger. She like moved things around. She just made it sound quite a bit better, in my opinion. And then during a match meeting, this was the other day, it was a match document meeting, so that's where you go over like your CV, personal statement, just everything that you need whenever you're in the process of applying for residency. She went over that with me, and she basically said, can we please squeeze in that you're like semi good at surgery? And I was like, okay, but I just didn't I didn't know what to say or how to say it. But I was like, I'm kind of good at suturing. And she was like, yeah, you just have to put at least like 3 sentences in about how you're good at something surgical. So I went ahead and added that, and then she just kind of said like, you have told us why you are a good person, like you would be a good physician, but not so much a good clinician, basically. I'll read her comments on the bottom. Kaylee, this draft is promising and includes just enough about your backstory without relying on it. The main skills discussed are being detail-oriented, proactive, and compassionate. These are all wonderful traits, but not exclusive to clinicians, yeah. Since you've used language that shows readers you have experience, leverage that by also including a brief example of a hard clinical skill related to surgery. Yeah, I remember reading something about that where they talk about soft skills versus hard skills. So it'd be like you're compassionate, but are you really good at physical assessments, or can you place a line or something like that? Like they really want you to have that down. That's why I like mentioned that I was doing CPR in the first paragraph, but I re-emphasized it by saying like, oh, I was so proud of myself for how well I did, and then I added the little paragraph about suturing. So hopefully that is good enough. But yeah, so now I will go ahead and have them read the final product, what I'm basically going to submit to my residency application. Let's go. Alrighty guys, sorry, Laura failed us, so I had to switch over to the Speechify. So let's go ahead and listen now.
Final draft. My two little sisters and I spent our early years in an environment of addiction and abuse. Despite never knowing my mother when she was sober, the soft spot in my heart for her remained, and we continued to see each other even after I was removed from her custody. When she overdosed in my lap on my 13th birthday, I resolved to follow a different life path. I decided to become a physician. My personal journey toward medicine is not pleasant, but I share it to illustrate my perseverance and determination, especially as a surgery residency candidate. Growing up and learning to function successfully within chaotic surroundings led me to surgery. The OR continues to take my breath away. In almost no other setting could I witness a 300-pound sleep-deprived man perform a bedside ECMO during a code with the grace of a ballerina. He didn't blink an eye as the chest compressions I was performing caused an arterial spray on his face shield. Ultimately, the patient's life was saved, and I was left in awe of how deftly the cardiothoracic surgeon had orchestrated a room of 20 people. I was also proud of myself that I administered adequate CPR without a second thought as soon as the code was called. Calming, confident, and adaptable myself, I have flourished during rotations as a team member. That said, I know my place as a student but will speak up when necessary and when I am sure of my reasoning. Recently, a 59-year-old pilot, who managed to do more push-ups in a day than I could in a year, presented to the ED with typical signs of stroke. I saw him later in the night after his admission to the hospital for observation and blood pressure control. During rounds the following morning, I perceived an acute change in his slurring of speech and unilateral weakness, so I immediately alerted the residents. They assured me the patient's symptoms were consistent with his notes. There was no need to escalate care. Respectfully, I insisted we consult neurosurgery. I had been on the admitting team and knew the man's condition had worsened even though it looked the same on paper. To this day, I am grateful for my proactivity. Neurosurgery ordered a stat CT scan that revealed a hemorrhagic subdural hematoma that required an immediate craniotomy. Thankfully, due to our urgent intervention, the pilot recovered quickly and returned to his workout routine within a few weeks. The first time I was handed a needle driver, I completely froze. I thought my hours of watching suturing and knot tying videos, reading about proper technique, and practicing on my suture practice kit at home that I would impress everyone in the room with my PGY1 level skill. I felt as though my hands and my brain had completely lost connection. Thankfully, my determination coupled with the patience and intelligence of my superiors allowed my suturing and overall surgical skills to improve exponentially. By the end of the rotation, I was competently closing axillary sentinel node biopsy incisions, trocar sites, and approximating deep penetrating wounds in trauma cases. With time, training, and dedication, I know I can accomplish anything. My confidence, conviction, and dedication to teamwork will help me on my journey toward becoming a great surgeon. I am also bubbly and positive, so I can keep things light while remaining focused and efficient in pressure situations. Further, my compassion ensures I communicate well with patients. During my internal medicine core, I encountered a 55-year-old male recovering in the ICU from his first seizure secondary to glioblastoma multiforme. I soon realized the man was frustrated that he did not know the original circumstances that led to his hospitalization. With a smile, I sat down and explained what had happened and that his seizures were now being controlled on the proper medications. As our conversation concluded, I noticed he was slowly lifting his right arm. He was using all his concentration and strength just to pat my hand in appreciation for my empathy and patience. I will always treat patients and I will always treat patients and their loved ones with the respect and care they deserve. I will also always draw strength and humility from my past. Rather than allowing my difficult childhood to determine my future, I choose to be empowered by it. For surgery residency, this means I will leverage my perseverance, adaptability, and intentionality as I work tirelessly to become the most competent surgeon I can become. As nothing is guaranteed in the OR, I am committed to proactive learning, methodical preparation, and the perpetual growth of my skills and knowledge. Thus, I am seeking to join a residency that has supportive members and leadership, a focus on teaching hands-on techniques, and opportunities to continue with research. In that environment, I will put everything I have into being a dynamic and impactful asset for my institution, teammates, and patients. As nothing is guaranteed in the OR, I am committed.
So as you can see, quite a bit of change from the first one to now. Like, you can definitely tell that like it came from the same base, but you can see where they like really helped me out in terms of like, even especially in the conclusion, where it's showing that I will put in the work and I will do what I need to do. And I think that's, my intentionality and tirelessness. Like, I think that's such good wording, and it's just interesting to me like what programs might want to hear. Like, I didn't put the bubbly part, and I didn't tell them that I'm bubbly. They just got that from like phone conversations and stuff. They put that in there, and I was like, oh, I didn't know that surgeons would want to hear that. I usually try to portray kind of the opposite, because I know that bubbly can be kind of ditzy, but I guess it comes off as a strength in my personal statement, which is awesome. So yeah, besides that, I am so happy with the progression since like my first one, it was very personal. It was something that I struggled with, I was like, how much of me do I put in here? And I put it all in there, but then I feel like I left out a lot of the part that would make me a great surgeon and physician. So I feel like also for example, the glioblastoma story, it's not really a story, but the patient case, like, that was more something that impacted me than the actual patient. Like, I'm sure that he was impacted and his wife was impacted that day, but I feel like the extent that I talked about it made it seem like it was more of something that I took home. So, and it didn't necessarily, come across as I'm just really good at communicating. So I'm happy that I probably would have kept that in, and that's like, that was a very long paragraph. I'm just saying, like, if you have a personal statement and you're kind of going on and on about one patient, and like, at first I was like, you really want me to cut out this patient? Like, what do you mean? This was so big to me. But then, like, seeing the edits now, I'm like, yeah, no, that makes sense. But I think it's come a long way, and I put a lot of work into it. I think my first draft was in March or so we are like 5 months later. So yeah, so I'm happy with where I am, and I was like really scared for the supplemental applications, because I was like, oh my gosh, there's another prompt where it's like, where's your hardship? And that was actually kind of a godsend, because that's when I did talk about my mom. But that will be the next week's podcast. It's just everything about supplemental ERAS applications. But yeah, my final thoughts. Your personal statement is your personal statement. It can be difficult to describe your entire journey to medicine, illustrate your growth throughout your training, and set yourself apart from other candidates. That's very hard to do, and I think it's less than 850 words. Like, it's just very hard to do, and without being boring. And they don't really even want you to do 850. That's like the max. I think they want you to be closer to 500 or something like that. So it can be really difficult. And it's not fun whenever you kind of feel like you have to like kind of make up stuff. Like, I felt like I didn't make up anything involving the suturing, but I was like, who really wants to hear about that? But then I feel like I flipped it on a good side, because I rather than just saying I'm good at it, I was like, I improved a lot at it. Because it is true, like, the first time that I ever tried suturing, I just like froze. Like I was able to start suturing, but as soon as I started knot tying, for some reason my fingers would just like, I just stood there like, why isn't this working? Like I don't know if it was, I think, you know, it was just, I was frozen. I was, what is it, you choked. I choked that day. So I'm very happy with all the things that I've accomplished, and I hope that it came across in the personal statement. And yeah, I hope to see you next time, and maybe it will be for the ERAS application. Woo!